If you brushed your teeth this morning, but still notice a strange smell from your mouth, hold on a second. This might not just be a dental hygiene issue. Bad breath isn't always about poor oral care. In the medical world, certain types of bad breath are seen as health signals from your body. Research suggests that specific breath odors could be linked to conditions like diabetes, liver disease, or kidney disease. For example, a sweet, fruity smell might point to high blood sugar levels, while an ammonia-like odor could indicate kidney issues. In cases of severe liver dysfunction, you might notice a distinctive sweet, moldy smell. Studies are actively exploring how these specific odors can aid in early disease detection. But hold on, not every case of bad breath means a serious illness. Most of the time, it's still caused by oral bacteria or dietary habits. So how can you tell the difference? Unlike typical bad breath, breath related to health conditions has distinct characteristics. First, it doesn't go away even after brushing. Second, it smells noticeably different from usual. Third, it often comes with other symptoms. Let's talk about diabetes-related bad breath. When blood sugar levels are high, your body produces ketones, which can create a sweet, fruity, or acetone-like smell. If you're drinking more water than usual, frequently visiting the bathroom and noticing this odor, it's a good idea to get your blood sugar checked. What about liver disease? When liver function declines significantly, toxins build up in the body and can be released through the breath, causing a sweet, moldy smell. This is called fetor hepaticus in medical terms, but it typically appears in advanced stages like cirrhosis. And what about digestive issues? Severe gastritis or gastroesophageal reflux disease can produce a sulfur-like smell due to certain compounds. Some studies have even detected unique chemical markers in the breath of patients with conditions like stomach or lung cancer, though this research is still in its early stages. In Japan, there was a fascinating experiment where trained dogs successfully identified the breath of stomach cancer patients. This shows just how closely breath odors can be linked to diseases. But here's the key point: just because you notice these smells doesn't mean you definitely have these conditions. They're potential signals from your body, so it's wise to consult a doctor. So what can you do in your daily life? First, prioritize oral hygiene. Brush twice a day, use dental floss, and get regular dental checkups. Using a tongue scraper is especially important since the tongue harbors a lot of bacteria. Diet matters too. Foods like garlic and onions cause temporary bad breath, but consistently eating sugary foods or not drinking enough water can lead to chronic bad breath. Smoking and alcohol, they're obvious culprits. Smoking not only increases the risk of oral cancer, but also worsens the oral environment, making it harder to notice health-related breath changes. Stress management is another key factor. Stress reduces saliva production, drying out your mouth, and creating a breeding ground for bacteria. Here's the most important thing to remember: if you notice persistent, unusual, bad breath, especially alongside other symptoms, don't hesitate to see a doctor. Your body is more honest than you might think. It constantly sends signals about its condition, and bad breath could be one of them. But keep in mind that bad breath alone isn't enough to diagnose a disease. For a healthier life, why not start paying closer attention to the signals your body is sending? Above all, regular health checkups are the best way to catch and prevent diseases early. A healthy mouth and a healthy body start with your choices.